Hello everyone. Today we are going to study about yoga therapy for diabetes mellitus. It is very important that before going to the management, it is must understood about what is the disease is. So that's why we are moving with what is diabetes and its definition, what a type of disease, its etiological factors, and how to diagnose this, and then we will go to the complications of diabetes mellitus, and then we will study about what is how to manage with yoga therapy. So according to the American Diabetes Association 2015, diabetes is a group of disorders characterized by hyperglycemia resulting from defect in the insulin secretion, insulin action, or both. The chronic hyperglycemia of diabetes is associated with the long-term damage, dysfunction and failure of different organs, especially the eyes, kidneys, nerve, heart and blood vessels. So, it is a heterogenic metabolic disorder. We already understood this, that by your physiological study in the previous years, it is a heterogeneous metabolic disorders whose main finding is chronic hyperglycemia. There is an increased blood glucose level. This causes either a disturbed insulin secretion or a disturbed insulin effect, or usually combined with both. So before going to the diabetes and its where the insulin secretes, we should know about anatomy and physiology of pancreas. A pancreas is an organ of digestive system and endocrine. The pancreas has both an endocrine and exocrine function. As an endocrine gland, it secretes a hormone called as insulin, glucagon, somatostatin and pancreatic polypeptide. The main function is of all these things is to regulate the blood glucose level within normal range. As an exocrine part of the gland, it secretes pancreatic juice that helps in the breakdown of the carbohydrates, proteins and fats. You know about the structure of the pancreas. It lies in the abdomen, stretching from behind the stomach, about upper abdomen near the spleen. In adults, it is about 12 to 15 centimeter long, lobulated. Anatomically, the pancreas is divided into four parts: head, neck, body and tail. The tissue that exists as a cluster cells, that is called as pancreas islets, or it is also called as islets Langerhans. So this is the structure of the pancreas. You can see the tail, body, head, all these portions of pancreas, you know, the common bile duct, the accessory pancreatic duct, adrenal papilla, duodenum. So around that this pancreas is head, body, tail is located. So the pancreatic islets each contains 4 varieties of cells. These pancreatic islets has 4 varieties of cells, that is alpha cells that produces hormone called as glucagon. Glucagon plays an important role in blood glucose regulation. Low blood glucose level stimulates its release. Whenever there is a hypoglycemia, there is a decreased blood glucose level, that time this glucagon is secretes and balances the blood glucose level. So glucagon increases glucose by break down the glycogen into glucose in the liver and decreases the uptake of glucose in fat and muscle. So the beta cells, first we learned about alpha cells. Now the second cell is a beta cells, the very important part of our discussion now. This beta cell produces a hormone called as insulin that plays an important role in blood glucose regulation. Elevated blood glucose level stimulates the release of insulin, amylin or islet amyloid polypeptide. But is very important is the insulin. So the insulin regulates the blood glucose level. Next cell is the delta cells that secretes a peptide hormone that is called as somatostatin, an inhibiting hormone which inhibits the release of both glucagon and insulin. So PP cells, pancreatic polypeptide cells or gamma cells or F cells secretes pancreatic polypeptide hormone. It plays a role in appetite as well as in the regulation of pancreatic exocrine endocrine secretions. So how the blood glucose level is regulated? So regulation of the blood glucose in the body helps to maintain normal blood glucose level should be between 60 to 100 milligram of deciliter of blood in order to supply the cells of the body which require energy. What is hypoglycemia? Decreased blood glucose level. Hyperglycemia, increased blood glucose level. So blood glucose is maintained within the normal range by hormones of pancreas, that is insulin and glucagon, adrenal gland hormone like epinephrine, norepinephrine and cortisol, pituitary gland hormone like growth hormone, thyroid gland hormone called as thyroxine. So this is the way where we can see the mechanism of how the insulin regulates the blood glucose level by acting on the various organs. So now let us go to the diabetes mellitus. I already told it is a hyperglycemia due to the insufficiency of the insulin or ineffectiveness of the insulin. So regarding diabetes mellitus, how many types are there? It's a very important, interesting factor that which diabetes we are very good in yoga, which diabetes you have to be careful or to go to the conventional medicines. That is the part of our discussion. So when you classify the diabetes, because as a student, as a BMI student, you should know about the diabetes in full to treat through any of our modalities, especially through yoga therapy. So when you classify the diabetes, which is normally we know type 2, type 1, type 2. What is type 1 diabetes? Insulin dependent diabetes. Means it's a juvenile diabetes mellitus. Means very early age it is onset. Immune mediated or it is idiopathic. Type 2 diabetes is a non-insulin dependent. It is insulin is not at all secreted here, is not there. First one, type 1, insulin is secreted. There is no much secretion. But type 2, insulin is secreted, but it is ineffective. Predominantly insulin resistance with relative insulin deficiency. Gestational diabetes, which comes especially for pregnant women. Secondary to diabetes mellitus, that is what, because of some diseases you get, some other diseases you get diabetes, that is secondary diabetes. Other specific types, genetic defects of beta cells function and others drug induced or malnutrition related. So very important, insulin dependent diabetes, I already told about this. This is characterized by insufficient or no secretion of insulin. Also there will be a autoimmune destruction of the beta cells in the pancreas. It is a very important factor you should know. By what is autoimmunity? Body start recognizing its own cell as a foreign agent. So that destructs the pancreas or beta cells of the islets of Langerhans. So that is why there is no secretion of the insulin at all. We have to give everyday injection. So type 1 diabetes represents 5 to 10% of all the people with diabetes. So far in today's our class, we are understood what is diabetes, what are the types of diabetes, where the insulin is secreted, which gland, which